Today we're going to discuss facial lower eyelid fillers. I'm going to go through the procedure with you, the indications for using it, and at the end of the video I'm going to discuss my favorite fillers that I choose to use. I'm Dr. Joel Kopelman. I'm a facial plastic surgeon in Manhattan. If you're new to my channel, please subscribe and let's get started and talk about lower eyelid fillers. Lower eyelid fillers to some extent also extend down into the mid-face region. It's not just purely a lower eyelid injection. It's also in the mid-face region that can have a direct effect on the lower eyelid. So there is different options that we can choose to decide which is the ideal filler. Well, first of all, I like to tell patients that in my hands, I've been doing this for over 10 years, I do it relatively painless because I prep the patient properly. The preparation, of course, starts even before you come to the office because I insist that the patients stop taking any blood thinners of any kind, and that includes fish oil, aspirin, Advil, Motrin, vitamin E, anything that can thin your blood. I want you to stop way in advance of coming to the office because really and truly, I don't want you to have any bruising or hematomas as a result of this injection. And because there's a lot of blood vessels around the lower lid, you can get some bruising, even in the best of hands. So when you go to your doctors, you should ask, should I stop these medications in advance? And the answer should be yes. When you go to visit your injector, whether they're nurse injectors or physicians, you should insist that this area be cleansed very thoroughly. Hopefully they're using alcohol or other antiseptics to make sure that you don't end up with an infection following the injection of the filler. Initially, when patients enter the office, my nurse cleanses the area very thoroughly. After about 5 minutes, we then apply a topical anesthetic cream to the area right here and let it sit there for 10 or 15 minutes because we don't want you to have any discomfort associated with this procedure. The second thing is I inject the patient with Novocaine-like medication called lidocaine mixed with what's called bicarbonate so it doesn't sting when the injection is done. Why do I do that? I do it because it prevents bleeding and bruising from occurring and it makes the injection much more comfortable. So I inject here and here a little bit of that solution and wait another 5 minutes or so. And now it's really numb and everything has been prepped and is sterile. And then we can use a cannula to inject this material. And I choose a cannula because it has a blunt tip at the end. It makes the injection of the filler much safer so that if that blunt-tipped needle bumps into a vessel, it doesn't puncture into the vessel. Okay, so there's a certain technique involved in this. So we use cannulas only around the eyelid. 100% of the time we will not use needles because we're afraid that we are going to enter a vein or capillary with this material which can embolize around your eye. So we want to protect you by using cannulas. There is a technique of injection and it's usually very deep and along the bone, and that way you avoid lumpiness and it looks very smooth at the conclusion of the procedure. Now you can get swelling following this procedure. The swelling in my hands occurs because the material itself can compress what's called the lymphatic vessels. These are not blood vessels. These are vessels that drain fluid away from our soft tissue. And for a couple days following the injection, you can become swollen. Not usually bruised, but swollen. So it may take up to a week for that swelling to go away. Okay? So don't be in a rush. Don't be in a panic. You've got to anticipate you may get some swelling. The swellings that may occur in some other offices because they have not been pre-injected with the lidocaine and epinephrine, which constricts the blood vessels and prevents bleeding. Sometimes they feel a lump in this area, and if it's a hard lump, it's due to what's called a hematoma, which is a collection of blood under the skin, and that takes a few weeks to go away. Now, the beauty of injecting hyaluronic acid gels under the skin is that it's reversible also. So there's an antidote called hyaluronidase, which is an enzyme which can break down the hyaluronic acid if you don't like it. If you think there's too much there or you just don't like the appearance of it, it can be reversed with an enzyme. This is rarely used in my hands, very rarely. 99% of the patients love my technique in terms of filling the grooves of the lower lid. So let me talk to you about the ideal filler that we typically use when we inject. Typically we use Restylane because Restylane does not cause excessive swelling under the eyelid. If you use other products like Juvederm, and I'm not paid by Restylane to say this, Juvederm causes too much swelling of the eyelid and can lead to puffiness that is undesirable. I only use Restylane. I know there are other products that people promote, but this is the product that I have found over injecting hundreds of people that this is the most ideal injectable to use under the eye. A more permanent method to fill the lower lid, of course, is to use your own fat. And that's a second option that some people may consider. So you can use fat from your belly or from your hip, and that fat can be spun down and injected in small quantities under your eyes to fill in grooves. And that has the potential to last the longest. And of course, it's a natural lid filler as well. But it does require a minor surgical procedure to extract the fat from the donor areas to graft it to your lower eyelid. So it's a little more complicated, and there may be some bruising associated with it as well. So that summarizes basically the lower eyelid filler injectable approach that I take, and you can discuss this further with your nurse, injector, or plastic surgeon. I hope you found this video to be informative and helpful. You'll have the right questions to ask your provider. Please leave any questions below and subscribe to my channel. I look forward to seeing you again in future videos.